Amanda Fuller.
And we're going to be doing our presentation on Virginia Henderson. We're going to be talking a little bit about her life and her theory as well. Virginia was born in Kansas City, Missouri, and she was the daughter of Daniel Brosius Henderson and Lucy Minor Abbott. She was named Virginia because her mother really liked the state, so she actually moved to Virginia at the age of 4, and she began school at Bellevue. And Bellevue was a school that was owned by her grandfather and taught by her father. She then enlisted into the Army School of Nursing because she wasn't able to get a degree from Bellevue. The Army School of Nursing treated their students like cadets, but had them take classes at various colleges like Columbia University in order to get their degree. So she began nursing at Henry Street Settlement in New York City after graduating from the Army School of Nursing. Her career: in 1924, she was a nurse educator at the Norfolk Protestant Hospital in Virginia. She returned back to Teachers College, which she took some classes at while she was in the Army School of Nursing, to obtain a higher degree, and eventually completed her bachelor's and master's degrees. She then taught nursing at Teachers College for about 16 years before moving on to helping with textbooks. She wrote the 4th edition of the Harmer textbook of the Principles and Practice of Nursing, which then became the Harmer and Henderson textbook of Principles and Practice of Nursing. She began her career in research at Yale University of Nursing as a research associate. She completed the 4-volume Nursing Index. This nursing index was the first nursing index in the history of nursing. At the age of 75, Henderson focused on international teaching and speaking. At the same time, she also began the 6th edition of the Principles and Practice of Nursing, which we'll be going into it later in the presentation to talk about her theory that she came up with. She encouraged patient independence in healthcare, and in 1979, she received the Virginia Henderson Award for Outstanding Contributors of Nursing Research from the Connecticut Nurses Association, and this was the first ever award given to a person or a nurse in history. So many people got the same award after she did. Henderson died a peaceful death at the Connecticut Hospice, and her legacy still lives on. We'll be talking about her theory next.
All right. Virginia Henderson's theory is the nursing need theory, and this focuses on patient independence in maintaining health. There are 3 assumptions in this theory. The first is that the nurse will care for the patient until the patient can take care of themselves, that the nurse is willing to serve and will devote themselves to the patient, and that the nurse is educated at a collegiate level in sciences and arts. This theory addresses all 4 paradigm links that we talked about in class previously. The person is the patient receiving care. This theory focuses more on individuals than on communities. Health, which includes the patient's biological, physiological, sociological, and spiritual needs. Environment, which is the locations where an individual learns individual habits for living. In this theory, the environment also includes family members. And nursing. And the nursing care includes providing the necessary conditions that allow the patient to independently perform the 14 components of this theory. Virginia Henderson's definition of nursing was, I say that the nurse does for others what they would do for themselves if they had the strength, the will, and the knowledge. But I go on to say that the nurse makes the patient independent of him or herself as soon as possible. All right, so next we'll go into the 14 components of the nursing need theory. So this would have fallen under the, this addresses the health in the paradigm links. So the 14 components are to breathe normally, to eat and drink adequately, to eliminate body wastes, to move and maintain desirable postures, to sleep and rest, to select suitable clothing, to maintain body temperature within normal range by adjusting clothing and modifying the environment, to avoid dangers in the environment and avoid injuring others, and to communicate with others in expressing emotions, needs, fears, or opinions. And those first 9 components address the physiological needs of the patient. And the next components are to communicate with others in expressing emotions, needs, fears, or opinions, to worship according to one's faith, to work in such a way that there is a sense of accomplishment, to play or participate in various forms of recreation, and to learn, discover, or satisfy the curiosity that leads to normal development and health and use of the available health facilities. The 10th and the 14th component address patients' psychological needs. The 11th component addresses spiritual well-being, and the 12th and 13th components address the patient's sociological health. So you can see that all of these components really truly address the whole patient. Tell me your name and date of birth. Beautiful. All right, then information matches. So Ms. Mays, today what we're going to talk about is the need to change position every 2 hours to keep your skin integrity intact and to prevent any pressure ulcers. So we're going to practice today by changing our position a little bit. Come, good girl. See, yep, just that change in position every 2 hours is going to be really necessary. Sit. Good girl. Yep, see all that good position changing. All right, so next time I come in the room, I'm going to have you show me how you do your position changes, okay? And you can stop for...
There you go.
All right, Miss Maisie. It's me, your student nurse again, Amanda. Can you please verify your name and date of birth for me? Perfect, that information all looks correct. All right, so remember what we talked about last time with the necessity for position changes? I wanted to see if you could show me the information that you learned so I make sure that you know how to take care of yourself once you're at the hospital, okay? Wow, look at that. Well, that was a great position change, Maze. It looks like you're all ready to go home.
Hello, my name is Freda and I'll be your nurse today. Can I have you verify your name and date of birth?
Hello, Freda. My name is Charles Smith, and my date of birth is 6/20/1959.
Thank you, Mr. Smith. As your nurse, I will be creating a care plan for you. And I see that you have been having increased urination at night.
Yes, I have. I haven't been able to sleep much because of it.
To begin, I will need to make some goals for Mr. Smith. Mr. Smith will be able to sleep through the night without having to get up. Mr. Smith will be able to use a bedside commode in the event that he has to urinate to reduce risk of falling. Nursing interventions. I will be teaching Mr. Smith how to use a bedside commode. I will be educating Mr. Smith on reducing his fluid intake before bed, and I will be making sure Mr. Smith is comfortable and relaxed before bedtime. Smith, how are you feeling today?
Much better. I was able to use the bedside commode once and slept through the rest of the night. I feel great.
Mr. Smith was able to sleep for at least 8 hours. Mr. Smith was able to demonstrate using the bedside commode at least 3 times, 2 hours before bedtime, and Mr. Smith appeared to be more energized in the morning. We were able to use Virginia Henderson's need theory to provide care for Mr. Smith. We used eliminate body waste, number 2, and sleep and rest, number 3.